Morning and welcome to folks that are chiming in. We're going to get started in just about a minute or two. We'll let people roll into the webinar. Thanks for joining us. Good morning to the folks that are just joining. We're going to get started in just about 30 seconds to a minute, just letting people join in. Right on. Well, we'll get started as people continue to come into the webinar. But good morning and happy Earth Month, everyone. Earth Day is in a couple of days. Thank you for joining us today. Zoom has already told you that this session is being recorded, but just a heads up. And in addition, we've also activated closed captioning, which can be turned on using the controls at the bottom of your screen. We'll save some time for questions at the end of the presentation, but please, as you do have questions, please drop them in the chat while they're fresh in your brain, and we'll surface them at the appropriate time during this session. We're super thankful and excited to have you all join us today and excited to dive into some important community climate resilience work we did with Kaiser Permanente this last year. So welcome, and we're super excited to get started. For those of you that might not be familiar with the Colorado Health Institute, CHI is a nonprofit mission-driven public health institute. We've been working with community groups, providers, state and local government agencies, and foundations for more than 20 years, really providing trusted analyses, data, strategic planning, facilitation, evaluation, and lots of strategic communication over the years. And we do mission-based work for clients and are also really fortunate to be funded by philanthropic partners who fund our public sort of facing portfolio of work. The work we're going to be discussing today is a partnership that we did with the Kaiser Permanente of Colorado, which is really a partnership that kind of developed over time. So we're really excited to dive into that. So to address really the growing challenges and impacts to the health of Coloradans from climate change, CHI launched what we call Acclimate Colorado, which is really one of our core areas of work, which is working to bolster the resilience of Colorado's communities to a warming climate. A couple noteworthy things that we've been up to over the last few months, just to update you all. We've done a lot of sort of like different types of strategic adaptation planning activities with different counties. We've helped launch the governor's first climate preparedness roadmap with the Office of Climate Preparedness. We helped the health system, Kaiser Permanente, in its role in climate resilience and how it can inform and make recommendations to other health systems, which is what we're going to chat about today. And we're in the thick of implementing and supporting community organizations in implementing an ambitious policy agenda that's really centered on community resilience. And that's with what we call our Acclimate Action Team. So our goals with Acclimate Colorado are really to drive policy changes that will help Colorado's communities become more resilient in the face of climate change and to improve health equity for the people that are the most affected. we really like to frame what we call the 3 A's that drive our work, which are really assessing the risks and strengths of community adaptation. We've spent nearly a decade pioneering climate and health indices and maps. We now have a climate and health indicators that are on our Colorado Health Access Survey, which I'll share a couple of data points from today. We also have been aligning major actors in the climate and health space through our Acclimate Action Team and through a number of different efforts that we've been convening over the years. And the action team actually brings leaders from across dozens of disciplines, government, nonprofits, advocacy organizations to really align on climate and health and de-silo. And then we're really advancing this work and providing kind of technical assistance, almost as a climate and health technical assistance hub for Colorado, and really to advance climate and health adaptation in Colorado. We were really thrilled to support Kaiser Permanente Colorado in their efforts to better understand the landscape of climate risks and the health impacts across its sort of service area, and really to be thought partners with them in developing recommendations with them. So we're really excited to dive into that today. For those of you that don't know me, I'm Kara Mamad, director here at CHI. I've been with CHI for 7 years, and with our Acclimate team, we've really built out our climate and health work over the years. I also focus a lot on evaluation, and I've worked with a number of different philanthropies and folks in the health and health sector spaces over the years to really kind of suss out and help them think about their role in health and community and climate resilience. I've also previously led community health needs assessment work with Kaiser Permanente of Colorado, my first couple years at CHI, and that's where we really initially started to hear about climate and health and clean air and clean water being raised as a priority by KPCO's communities. So our guest speaker, Lisa Romero, will touch on that a little bit. I'm joined by my colleague, Emily Santich, if you'd like to introduce yourself.
Yeah, thanks, Karam. Hi, everyone. I'm Emily Santich, and I'm an analyst at CHI. I've been here for about 3 years, and I lead a lot of work related to assessments and in the climate and health space. So I'm really excited to share about our work in partnership with Kaiser Permanente Colorado, where we've identified some opportunities for health systems to advance community resilience to climate change.
Thanks, Emily. Today, we're really going to, for our sort of agenda for today, we're going to share some new data. Some of this was released with our CHAS launch, but for those of you that are tuning in, we're going to be sharing some of our data from our Colorado Health Access Survey. We're then going to share some findings and recommendations from this project we did with Kaiser Permanente of Colorado last year, which Emily and Lisa are going to touch on. And then we'll hear directly from Lisa Romero from Kaiser Permanente on some of the actions they've taken since this report came out about the fall of last year. And then we'll hold some time at the end for some audience interaction and Q&A. So keep your phones and your keyboards ready for an interactive activity. It would be a CHI presentation without 3 key takeaways. So if there are 3 things that you remember from today's presentation, it's these. 1, climate change is affecting the health of communities in Colorado today, and they definitely do not feel prepared. 2, health systems can advance community climate resilience work. We're going to really focus on that today. And 3, everyone, we mean everyone, really has a role to play across education, advocacy, climate leadership, community health, and research. There's a role really for everyone in this space and in this work. So some data from our newest Colorado Health Access Survey asks Coloradans how climate change is impacting their health, and the results are really interesting as you break them down. First, it's really alarming to sort of see that nearly 2 million Coloradans say that climate change impacted their health or their family's health in the last year. Second, you can see on this left side of the screen, you can see some of the most commonly reported health effects. You'll see not surprisingly, if you're sort of familiar with the work, but respiratory illness or problems breathing, so folks who have asthma, folks that have chronic obstructive pulmonary disorder, people that are just experiencing asthmatic types of symptoms and respiratory issues because of poor air quality. And when we have wildfires in and out of Colorado blowing into our state, that came up as the #1 reported health issue. Mental health has a connection to climate change as well, which we're really looking forward to unpack some more over this next year. And then you'll see chronic illness, wildfire injuries, and sort of a series of other connected health effects rising up as well. So we're excited to, this is like kind of our first foray looking at the data, but we're excited to really dive into this deeper. And if you're interested, please reach out. At the same time, we also asked Coloradans how well prepared they felt their communities were to respond to a natural disaster or a climate disaster. And the results are mixed, but almost half of Coloradan adults indicate that their communities are not prepared or somewhat prepared for a climate disaster. And essentially the same percentage of those who feel that they are prepared. So there's plenty of work to be done in preparing communities. And the good news is that this is beginning to be on the radar for health systems, for their providers, and for the communities that are working to act on climate change. And you'll see, here's actually a medley of recent reports and articles really emphasizing the growing role that hospitals, health systems, and researchers in the health space are really starting to take to connect the dots between health and climate change and actions they're taking to improve community health. Lots of this kind of work is really around how health systems can partner with community-based organizations to protect community. And the thing I really want to note here with this slide is a lot of sort of what we discovered in our work on this project is beginning to pop up in other places and in other states. So the dots are really starting to connect for health systems, for public health, and really factoring in climate as a priority for their communities. So in Colorado, Kaiser Permanente's most recent community health needs assessment really identified climate and environment as a top health need. And there's really a growing recognition that building community resilience to climate change is essential for both physical and mental health and well-being. So we're going to have Lisa Romero share a little bit about what that work has looked like for Kaiser over the last few years. And Lisa is a senior community health specialist with KPCO. She really works to support investments in community health initiatives related to access to healthcare and environmental stewardship. She's really like leading their thinking around that here. So I'm going to pass it off to Lisa to really talk about what's the opportunity in Colorado that Kaiser has identified.
All right, thanks, Karim. So thank you everybody for joining us today. Really excited to be here. As Karim mentioned, my name is Lisa Romero, and I work with the community health team here at Kaiser Permanente Colorado. And I'm going to come back to our work as a team here in just a minute, but my goal today really is to highlight sort of the history of environmental stewardship work at Kaiser Permanente and how we think of that whole program area, how we really want a community focus to inform that work, and why we wanted to really gather more community input into how we could be a meaningful partner in this space. Before I move forward, I'll just give a little bit more about my own background and sort of the lens that I bring to this work. So I am a clinician by training. I'm a physician assistant, and I started my clinical career in Commerce City, Colorado. And I think it's not surprising to anyone on the call that that is a very environmentally burdened part of the Denver metro area. And that's really where I recognized firsthand just the true depth and breadth of impact that a polluted environment can have on the health of patients and families. And so I knew from my work then that I wanted to move upstream of the exam room and really do what I could to foster healthy environments for healthy communities. So I joined Kaiser Permanente in 2015 in a clinical capacity, eventually got my master's in public health and moved into this role with community health in 2022. So for those not familiar with the community health part of Kaiser Permanente, we, as Carm mentioned, are the department that manages all of our community health investments and partnerships and philanthropic initiatives, so grants and donations that we provide in the community across a number of program areas that are really meant to foster an environment conducive to health. And that includes, as Carm mentioned, access to care, includes food and nutrition security, housing, and our environmental stewardship work. And it's deeply informed by our community health needs assessment that we complete every 3 years. So that will kind of come into play again as we talk about where the design for this report came from. So coming back to environmental stewardship work here at Kaiser Permanente, we have been active in this space for a number of years. Really, initially, our focus was on reducing our environmental impact as an organization, knowing that as a healthcare provider, we do have a significant footprint. You know, healthcare is a very energy intensive industry. We have a huge supply chain. Our operations have a direct and significant impact on the communities we serve. So we recognize that, and we've had longstanding goals around things like emissions reductions, reducing our waste, reducing our water usage, really engaging in sustainable purchasing and responsible purchasing practices. Some may recall we were the first health system to become carbon neutral back in 2020, so it's really been part of our DNA for a long time. But while healthcare sustainability isn't necessarily unique in the industry, especially at this time, one strategic decision that was made around this work has really affected the perspective that we bring to this work. So we have housed our environmental stewardship work under the larger umbrella of community health. And, you know, unlike a decision to maybe put that work with facilities or put it in an independent sustainability department, what that really did for us was give us a lens to think about environmental stewardship from the perspective, as I mentioned, of the health benefits that brings to the communities we serve, and really let us think about environmental stewardship within and beyond our four walls. So moving to how we think of environmental stewardship outside of our own operations, it really came down to two different focuses. So foci, I don't know, I haven't had my coffee this morning, or not enough of it anyway. First, we really thought about how can we use our position as a healthcare sustainability leader to drive change in the industry and the sector as a whole. So we knew that the work we were doing is important, that it was impactful, but we also recognized that Kaiser Permanente is one of many systems in a very large sector here in this country. You know, we knew that healthcare now, this is responsible for 8.5% of our national greenhouse gases. So, but to really make true meaningful change on a sector scale, we knew that we had to partner and collaborate. So part of our work has really been around driving collective action, working with organizations like Healthcare Without Harm, National Academy of Medicine, and others to really to drive not just organizational change, but sector-wide change. And the second focus, which is really what brought us to the work that we're talking about here today, was thinking about how do we show up in community to foster conditions conducive to health the same way we do in our other program areas, thinking about housing, food, access to care, recognizing that we need to help our communities get and stay healthy and build resilience to the environmental hazards that are present now, like heat and air pollution that we also know are going to worsen with climate change. So coming back to that community health needs assessment, and as Carm mentioned, here in Colorado as a region, we've seen climate and environment rise to one of our priority needs on our community health needs assessment. So on one hand, we knew from our history with environmental stewardship that this was an important need, and now we're hearing it from our community here in Colorado. And we recognize that this really was our moment to start investing in these community initiatives in this space. But we also recognized that this was a sort of a new domain. We hadn't been very active in this space before. And as a health system, it would surprise people sometimes that this is a space we want to take it into. So realizing all of those factors at play, we really wanted to make sure we took the time to go even beyond the information we had in the community health needs assessment, and really make sure we went deeper with community and stakeholder engagement to ensure that we aligned our investments and showed up as a really meaningful partner in this space. So I hope that's provided a little bit of context and background for how we got here. I'm going to pass things to Emily to talk about exactly how they engaged in community and what the report findings were. And then I'm excited to share some updates, as Carm alluded to, after we've heard from Emily.
Thank you so much, Lisa. That's really helpful background. So to talk a little bit more about the report and some of the findings that we identified, the purpose of the work that we did with Kaiser was really to identify recommendations for health systems and charitable organizations to support, lead, and advance climate change mitigation and adaptation efforts in Colorado. And as Lisa mentioned, the way that most health systems to date have kind of taken action in this space is through mitigation. In other words, reducing their own greenhouse gas emissions and improving sustainability efforts. And these efforts are really crucial, but we also wanted to understand the needs of communities as they interact with a changing climate and the role of health systems in advancing resilience. So I'll share a little bit about our methods just before we jump into recommendations. So CHI's process included both quantitative and qualitative data collection and analysis, and our research focused on Kaiser Permanente Colorado's service area. So while it's not inclusive of the entire state's geography, it encompasses about 85% of Colorado's population. So for our quantitative data analysis, we assess the relationship between climate impacts, such as extreme heat, wildfire risk, and air quality, and the social and demographic factors that have been known to elevate health risks in communities. And for our qualitative data collection and analysis, we met with 20 organizations representing local departments of public health and environment, climate offices and organizations, safety net clinics, community-based organizations, and K-12 education partners. And we asked key informants about current efforts, partnerships, funding, needs, and gaps in their communities related to climate mitigation and adaptation. So from that data collection and analysis, we identified a set of recommendations for health systems and philanthropic organizations to consider. And we organized these recommendations by topic area. So these include education, advocacy and leadership, community health initiatives, data and research, and assessment. And on the next couple of slides, I'll kind of walk through each of these and share some examples of what this can look like. So the first is education. This is our first recommendation area. And this is both education of health professionals and of patients and the community. So we need to educate health professionals about the effects of climate change on patient health and train them on screening and referral for climate-related health impacts. One key informant told CHI that health systems need to view climate impacts as health impacts, something that your family doctors can treat and prevent. Another key informant told us that nationally, a lot of health professionals think that climate and health education is important and affects their patients, but they're not comfortable or confident in addressing these impacts inside and outside of the exam room. So there are a number of resources and tools to guide health professionals in having these conversations, such as the one from Eco America and Climate for Health that you see on the screen. The next piece of education is to provide education to patients and the community regarding the impact of environmental exposures and climate change on health. One example of this is that older adults, young children, and people taking certain medications are particularly sensitive to extreme heat. So they need to know how to mitigate their own risk and resources that are available to them. Healthcare providers are well positioned to provide this education because they're among the most trusted professions and they have regular touch points with patients. So the next area of recommendations are related to advocacy and leadership. And this was another big area of focus from what we heard from the key informants that we met with. And they told CHI that right now, providers with an interest in the intersection between climate change and health are stepping up as advocates and leaders, but there's a need for greater engagement from health systems as a whole. So this can look like further engaging in efforts to decarbonize the health sector in the US. As Lisa mentioned, the US healthcare system is responsible for almost 10% of all national greenhouse gas emissions. And so health systems can advance and model sustainable practices. They can train and incentivize their staff to provide high value, low waste care, and encourage staff at all levels to be conscious of resources and waste. And key informants really emphasize that this doesn't need to be punitive, but this can actually be positive, such as creating green awards to recognize sustainability efforts. Another place where we can see this is advocating for policies that benefit both the environment and human health. So an example of this is policies that improve and increase the usership of public transportation. Designing more walkable cities and expanding public transportation infrastructure is both healthy for residents and it reduces vehicle emissions. Another way is to join cross-sector partnerships to align stakeholders' efforts. One key informant told CHI that we need other organizations, not just cities and health departments, to be the leads on this work. Really, the entire ecosystem, healthcare, nonprofits, local government, and community members need to be involved. And another example is to build partnerships with local community-based organizations to better connect patients to resources for climate change adaptation. We know that providers don't want to do the screening if there's no place for referral. So this is really about building those relationships. And many health systems already screen and refer patients for social factors that influence health and can use a similar model for assessing climate-related health impacts. Informants also stress that health systems need to consider the effect that increasing referrals may have on service demand and work with community-based organizations to evaluate and address their capacity to meet community needs. The next recommendation area falls under community health initiatives. So organizations working to increase community resilience to climate change need additional support. And we heard this time and time again in our interviews with folks. Key informants told CHI that current funding is not enough to sustain and expand the programs and workforce necessary to protect communities from the impacts of climate change. But these opportunities need to be flexible and minimally burdensome. One key informant told us that a lot of grants are not friendly to the community because they require lots of paperwork. Small nonprofits don't have all the time for reports and meetings. So there needs to be greater funding for BIPOC organizations who are trusted and respected. And this can include supporting efforts to address extreme heat, air quality, and drought. These particular impacts were locally informed and specific to Kaiser Permanente Colorado service area. So these priorities might look different in the parts of the state that you are living in or serving. And the next recommendation area is data and research. So a couple examples of what this can look like. The first is to partner with organizations conducting studies that explore the relationship between environmental exposures and health. Researchers are currently piloting interventions to assess their effectiveness and improving key environmental metrics. So pairing study data with health data would allow researchers to evaluate the effectiveness of interventions on health outcomes. So an example of this is switching from gas to electric stoves and evaluating the impact on indoor air quality and health outcomes such as asthma and other respiratory conditions. Another example of what this could look like is collecting data to better understand how environmental exposures and extreme weather events relate to health outcomes and healthcare utilization. Key informants told us that if health systems had a better way of tracking environmental exposures and health outcomes, it could inform local decision-making and advocacy efforts. And finally, under data and research is to support evaluation efforts to measure the impact of existing programs. Many community-based climate mitigation and adaptation efforts are just beginning, and so evaluating these programs will add to the pool of evidence-based and promising practices that can be scaled and replicated. And the final recommendation area is assessment. So assessments can be an opportunity for health systems to incorporate climate and environmental metrics into both secondary data collection and community engagement efforts. I really like this quote from one of our key informants because it asks, what does the community want and care about? And as Lisa mentioned, it's really important to center community experiences and needs in all of these efforts. So I hope that was a helpful overview of the various recommendation areas and some of the findings that came out of this research. And now we want to turn it to you all to hear from you. So Karim is going to pull up a mentee activity, and we'd like to hear from you where you'd like to see more investment in your community. So you can go ahead and head to mentee.com, either on your phone or web browser. I will also drop this information in the chat. So you can go to mentee.com, and then it'll ask you to type in this code, and then you'll be able to participate in our activity. So we'll give everyone just a little bit of time to pull this up on your mobile device or your web browser. You can also scan the QR code. All right, Karim, do you want to advance to the activity? So we're really interested to hear from you all, kind of based on what I've walked through in these different recommendation areas. Rate the level of action or investment that you feel is needed in your community and that you'd like to see. So you're able to kind of rate each of these different areas and let us know where you'd like to see more action and investment in your community, either where you live or where you serve. So are you really needing more effort in the education space, in the advocacy and leadership space, community health initiatives, data and research, assessment, or something else that maybe we didn't identify? Great, so we can already see folks starting to cast their votes. We'll leave this up for just a little bit longer. Great. Well, thanks everyone for participating. So it looks like a lot of folks, based on the way that they voted, really are seeing a need for additional advocacy and leadership, as well as community health initiatives, followed by education, data and research, and assessment. Great. So we're going to open it up pretty soon to Q&A. And I would encourage folks on the call to either come off mute to ask us questions, or I'd be curious to hear for folks who voted in this activity, if you want to share with us a little bit more about why you voted a particular way. So thanks everyone for participating. That's helpful to kind of see where folks are seeing the greatest need in their communities. All right, so we're gonna toggle back to our slides here. And I'm going to pass it back to Lisa Romero. She's going to share with us some of the ways that Kaiser has been advancing this work since we did this research together.
Yeah, thanks, Emily. I did want to jump in with just a little clarification for folks on the call. So Emily mentioned that this report, and especially some of those community health needs, came specifically from our footprint here in Colorado. And just for folks on the call who are not familiar, the Kaiser Permanente footprint here goes from Fort Collins down to Pueblo along the Front Range. So it covers a lot of the population center in the state, but some of the geographies are certainly very different, as we all recognize. So if that's helpful context. But I'm excited to really share that this report has guided our work in environmental stewardship as a region since we've gotten the results. And I'm just going to touch on the different themes that Emily mentioned and sort of share a couple examples of how we've really leveraged this information to partners. So first and foremost, education of patients, clinicians, and community members around the connection between climate and health has been something that's we've really engaged more in. We've had multiple internal webinars and trainings that touch on this topic and really talk to our workforce about that connection, why it's important, and why folks should be can get involved and how they can do that. We have really also focused on some of those community health initiative requests around supporting resilience to heat and air pollution. You'll see a couple logos here on the slide, but we have partnered with the Love My Air Denver program to really enhance and expand their work in putting air quality sensors on environmentally impacted schools and clinics in the city and county of Denver. And that's paired with monitors and a smartphone app to really provide that data to the folks who need it so that they can take action to stay healthy as students, as staff, as teachers, and then also school nurses get that information as well. We partnered with the Downtown Denver Partnership to support the Urban Forest Initiative to really enhance and support the urban tree canopy as a means to help counteract extreme heat in our city, which has a really insignificant tree canopy when it comes to getting some of those heat benefits. And then we've done some partnerships and volunteering with Groundwork Denver and really hoping that I'll have more exciting updates to share about some more initiatives in this space, maybe on the next webinar. So thought leadership and advocacy is also a space that we have been really active at the Climate and Health Nexus and informed in large part to this report. So, we participate in multiple convenings. I mean, this one with CHI is a great example, but we've also done work with National Academy of Medicine, Eco America, World Economic Forum to really ensure that we are sharing our knowledge, sharing our experience, and sort of spreading the importance of really centering health in the climate conversation. And those are forums that have really reached large audiences, which has been great. Kind of coming back to the education of patients, we're also starting to think through how we can, as a healthcare system, develop and implement and incorporate environmental considerations into the care of our own members. And then finally, we are really, we're gearing up for our next CHNA, Community Health Needs Assessment cycle that will start in 2025. And so here in Colorado, really making sure we identify community partners that have a lens to climate and environment and environmental justice and equity, making sure that they are part of our stakeholder interviews, but also making sure that in our other regions and our other service areas in other states that are starting this process as well, that they have thought through including that perspective in their stakeholder interviews as well. So Colorado's been somewhat unique in having climate and environment show up on our CHNA, but we're really wanting to make sure that we bring that to our other regions and make sure that that perspective is included. So just a few examples. I hope they can be maybe inspirational for people who are trying to figure out how and where to get involved. I'm always open for questions if anyone wants to reach out. And I'm excited to hear from folks who weighed in on the poll and see what else they have in mind. And I'm really curious to know what the other options were that folks put in. So yeah, I'll pass it back to Carl.
Thanks, Lisa. And it's really exciting and encouraging. Just personally, as I worked on the community health needs assessment with Kaiser, it must have been 5 or 6 years ago, to see climate and health and clean air and clean water come up as priorities from community, and to see this come full circle and see that Kaiser is really leading in this space just a few years later is really encouraging, and great to see that responsiveness from the organization with the community that it serves. So thank you, Lisa. So to just remind ourselves of the key takeaways from today's discussion before we go into a Q&A is, of course, climate is, we know it's affecting the health of some of our communities today, some more than others, and their level of preparation is really varied. They do not feel prepared in many cases, almost half of Coloradans. Uh, as we heard from Lisa, health systems can absolutely advance community climate resilience work, and we heard a few examples of how that can be done. And then really everyone has a role to play as you all sort of engaged on what you sort of scaled to be priorities for your communities. I'd love to hear from you in the Q&A across these different areas: education, advocacy, leadership, community health, data and research and assessment, all these different areas. We'd love to hear from you where and other, you know, there were a lot of people that clicked other as well, where sort of your role is or roles that you'd love to play moving forward. So I'm gonna move us to Q&A and really open it up to the audience to see if folks have questions, to see if folks wanted us to follow up on anything that we shared earlier in this presentation. If you have questions for me, Emily, or Lisa, we're happy to really start to dive into those. And you can raise your hand, and Joe on our team will actually unmute you if you do have any questions that you'd like to verbally ask as well. So you can send them in the Q&A feature, you can put them in the chat, and you can also raise your hand if you'd like to come off mute. And you'll see in the chat that Lisa is actually sharing a couple of resources. There's an upcoming webinar actually on Earth Day for folks that are interested in learning a little bit more from the National Academy of Medicine on their role in this climate space.
I'll just share
Yeah,
my text skills are apparently a little bit subpar this morning. My hyperlinks didn't come through, so I'm going to drop the link to the registration pages separately.
Yeah, no worries.
Hi, everybody. I'm Katie McLaren. I work with the city of Fort Collins on climate-related issues. I use she, her pronouns. I have lots of thoughts in this space, as some of you may know. Think about it a lot. And a couple of areas for support around data and research specifically, which is one of the areas that I ranked really high. And it's, I think, for communities across Colorado, particularly maybe mid-state up, that are less, you know, have had less historical experience with extreme heat in particular, getting support to make the case with emergency managers that this is a challenge for communities and individuals and groups, I think has been one of the more frustrating parts of my work in this space. They look at historical data. They only look at emergency room visits. And even though you can see those numbers ticking up, they don't know what the problem is. And I think the way I've thought about this is a lot of these kind of medium level threats, right? Like we're not talking about a giant storm coming in and, you know, flash flood sweeping through community. Like those are the type of events emergency managers have developed entire systems around. But more of these kind of medium threshold, you know, there's still natural hazards, so I don't know what the problem is, but in other communities, other states, emergency managers are very active in extreme heat. But I've just come across this kind of historical perspective that's been really challenging. So I think, you know, if there's some opportunities in this space to talk about, even though, you know, we aren't going to hit some of these really high thresholds in the heat index, there's still people that are going to be really negatively impacted. The mortality rates may not be the same as they are places in Chicago or Minneapolis or Atlanta, but these are problems that they need to lean into. That's one area. The other is really supporting, you know, and I think about this in terms of the trusted community sites where people will go to when they need to be more comfort. And I think there's two layers to that. So, sometimes people use climate hubs or resilience hubs. But really, one, I think there's education around for practitioners and helping people know when they need to evacuate their homes. And we know that most people would rather just stay in their homes. Why would you go, if your refrigerator is closed, your TV's closed, your pets are, around, why would you take public transportation to someplace you don't know? I get that. So what are the ways that we can build up better understanding and advocacy and education around, if your home gets to 90 degrees, I'm sorry, you really need to think about your health. It needs to prioritize versus some of these levels of comfort. So I think there's some support in that as well. And I think too, around we in Fort Collins, we haven't had a lot of traction in this space as much as I advocate. And really our focus is around the most vulnerable populations, focusing specifically right now on the unhoused. So, working with those community centers or the shelters that those folks go to, either to extend their hours, and then also, there's a big need around infrastructure. So they need better, HVAC systems. So there are some needs that I can see, groups that have foundations that have money to really support these groups to, do they need, better air filtration? Do they need a more efficient cooling system on hand? So, because, some of the solutions we've talked about really are pretty inadequate. You can't just fill a room with like portable air filters and expect it to be as impactful as it needs to be. And then there's operational considerations, lots of capacity needs in this space. So those are just my initial. I'm glad to talk offline as well. I've thought a lot about this and looked at other communities in different states that have this more at the forefront. So thank you for my long-winded questions / comments.
Yeah, no, I appreciate that, Katie, and good to hear from you. It's good to hear one that sort of data and research flagged for you, because we have some new data here at CHI that we do really want to unpack. One thing that I will note is through our Acclimate Colorado work, we do provide kind of the service of technical assistance if people are interested in a data pull for their locality, the community that they're working in. I will note that our Colorado Health Access Survey does have the ability you can do crosstabs on the climate data that we now have. You can look at health outcomes, you can look at mental health outcomes, you can look at whether or not people have access to care, and you can overlay that across different demographics, age, income, gender, all sorts of things. And moving forward, we'll be able to trend that as well. So we haven't even scratched the surface of what we can do with that data. I will also note we have a health and climate index up on our website that came out last year, and that tool allows communities to really look at what are the sort of social factors, the health factors, what are the communities that are most disproportionately impacted in my community? What are the health, or what are the climate exposures? So is it extreme heat? Is it wildfire risk? Is it a medley of different sort of environmental risks? And then like, what is the local action currently? So that tool allows folks to kind of dive into that as well. On your notion of this kind of like medium risk, I think like that totally resonates, Katie, that this notion that people aren't going to take action until it's too late, essentially, is it's a common theme in health as well, not just in sort of the climate and health sphere of work. And it's something that we need to be mindful of. And there are more and more data tools. Like if people are responsive to data, that's one key piece, but I think pairing that with community voice, and I think that really like advocacy and community voice lens and education is really key. So there is no one fix. Data and research is not going to fix the issues in a local community's preparedness for a climate disaster, or even these like medium, we have a 105-degree day and people don't have access to cooling. That's not going to, data and research is not going to solve that. You have to pair that with local implementation. You got to pair that with education. You got to pair that with actually giving people access to resources that they need. So I appreciate that. And then I saw there was another question in the chat, it looks like, and it's from Kristen, and it says a
Hey,
question
Kyle.
about policy implications. If you're thinking about that as part of the work, absolutely. We're thinking about, so let me be sort of very precise in how I describe this. We've got our like Acclimate Colorado work at CHI, and we actually have a policy agenda that breaks down 5 areas. We look at the sort of workforce we need to address climate and health impacts in communities. We look at the infrastructure needed. We look at the data needed. We look at the adaptation planning needed. And we've got 5 to 6 different sort of policy implications and policy actions that people can take. And that's, we can share actually a link to that policy agenda in the chat or in the follow-up. And then Lisa, is there anything you want to share about sort of policy from the Kaiser perspective? I know you touched on it a little bit in some of the examples that are starting to pop up.
Yeah. Remind me, I do want to come back to a couple points that Katie made, but what I would say in the policy space is really the policy and advocacy space, our efforts have been focused more on thought leadership and really kind of trying to bring folks along and share best practices and again, center health and health equity in that climate conversation and really help connect the dots. When it comes to, policy, as we think of it in policy making, it's a space where we have not been active at this point. We are thinking through what our approach to policy advocacy looks like in this space. And I'll just share, Kaiser Permanente tries to be really thoughtful about, making sure that where we weigh in and when we weigh in, it's in a way that adds to the conversation, that brings a new voice to the conversation, and really is a place where we feel like our expertise is unique and able and likely to make a difference. So a lot of considerations there, and hopefully more to come down the road. And I would say, kind of going back to some of the points that Katie made, I think you're absolutely right. The education piece kind of comes back to the forefront. And I talk to folks all the time, and people are shocked to learn that heat is actually the deadliest weather phenomenon, on a yearly basis already. And, we know that that's going to get worse. And so I think people really don't understand as individuals, and we don't understand as communities that really is a significant threat to health and well-being. And we have a partial picture, right? So we know about, maybe hospitalizations, ED visits, and deaths, but we've sort of thought through how can we, as an integrated kind of closed system, look at not just those emergency visits, but our calls to the office, our, primary care visits, our nurse visits. So more to come there as well. And I will just put in a plug, Katie, if you're still on, if you're really passionate about that research space, that first link that I shared was all about a research agenda that's under development to address gaps in research at the nexus of climate, health, and health equity. So if you have capacity to join for any part of that, please check it out. So yeah, I think I covered all my points that I jotted down.
Thanks, Lisa.
Yeah.
Any other questions before? I want to make sure we've got just a couple of other slides on sort of how folks can get involved, and we'll throw up a link also on our new, what we're calling a climate catalyst, which will be a quarterly sort of compendium of resources and climate and health related news you can use from CHI. Any final thoughts or questions from folks?
And Karam, while folks are thinking about their final questions, if you did respond to that poll and put other, would you let us know in the chat? Because I am curious, and I think Lisa and Karam too, to know what areas you think need additional attention and focus that are outside of some of the ones we listed. So final thoughts and questions, and if you're willing to let us know how you're thinking about this in other ways too in the chat.
Right on. Well, just to move us forward, if you're interested in getting involved with CHI's Acclimate work, as I mentioned, we've got this policy agenda that we really designed this policy agenda with an action team of, and some of the action team members are actually on this call, Lisa included, with policies and strategies in mind that really anyone in the health or community or environment or any space really can see themselves showing up. So we encourage folks to take a look at that, reach out if you have questions or if you'd like to learn more. We've got some policy strategies in there that some folks are already starting to champion. And if you're interested in learning more or partnering on that, please let us know. Also, if you'd like to join the action team, that's another thing that you can do. And then you'll see at the top, you can sign up at colo.health/climate list, and that is for the climate catalyst that I had mentioned. Our communications manager, Deanna Geldens, has really put together a really cool sort of compendium, and this will be kind of our dispatch for all our climate related resources quarterly. So make sure to sign up on there, and you'll be in the know on new climate work coming out of CHI. I want to put a plug in for our next webinar, and this will be on May 23rd. Please join us it'll be a breakdown of the legislative session with Joe Hannell from our team, really focusing on what are the kind of key themes, summaries of health-related bills from the legislature this session. You can register with the link below. There's a QR code at the bottom, and the code at the bottom, maybe we can put that in the chat as well, is colo.health/24 LEGREG. So please join us in about a month from now to talk about the legislative session. It's been a doozy. At some point we felt like they're going to hit 1,000 bills this year, so there will be a lot to unpack there. And yeah, we appreciate you all joining us this morning. If you have any questions, feel free to reach out to us. Here's Emily's email up on the screen, but if you want to reach out to me as well, please do. My information's up on our website. And we thank you again, everyone, for joining us today. Please do not hesitate to reach out with any questions, or if you'd like to discuss any partnership opportunities. If you work for a foundation, or if you're working for a health system and you want to learn more about the role that you can play in climate, please give us a call. We really enjoy thinking through really right-sizing the different roles that people can play in this work, and we'll be in touch. Thank you all again.